on this Wednesday evening for our 2021 State Capitol Day event. Normally we would be gathering in person at the State Capitol building, but we're really excited that we're still able to have it in a virtual capacity this year. My name is Drew Brothers. I'm a board member and public policy chair for the AFSP Indiana chapter. And tonight I'm going to be joined by Kelsey Stewart, who's our Indiana area director, and Adam Jackson, who is a board member and our Project 2025 chair. This is the agenda for this evening. We're going to have some opening remarks from elected officials. Adam is going to be going over some suicide facts and figures. Kelsey will cover Advocacy 101. We'll talk about some of the public policy priorities that we have for the state of Indiana. And then Kelsey will finish by letting you all know what you can do to take action to help fight suicide and support mental health and suicide prevention legislation. At the very end of the presentation, we will have a Q&A session. Those questions are going to be for the AFSP Indiana chapter. And if you have any questions that you think of during the presentation, you can feel free to pop those questions in the chat and we'll get to as many as possible. So this is the list of elected officials that are going to be having some opening remarks. They are Governor Eric Holcomb, State Senator Michael Crider, State Representative Bo Bard, Indiana Senior Senator for the United States, Todd Young, State Rep Chris Campbell, and State Senator Shelley Yoder. So to start, we're going to play a video with Governor Holcomb's recorded remarks.
Hello, I'm Governor Eric Holcomb. Thank you for the opportunity to join you virtually for the American Foundation for Suicide Prevention Indiana State Capitol Day. Thank you for giving your time and talents to passionately support research, to educate, to advocate, and act, and to ultimately save lives. And I know that is the very thing that drives you and should motivate each and every one of us to continue to do everything we can do to support Hoosiers who are in need of mental health care by empowering them, by ensuring that care and treatment are within reach, and working toward that goal together with you. That's the mission of Indiana's Suicide Prevention Network. And it's why we're getting the word out that help is just a call or a text away. And it's why we're providing mental health first aid and suicide assessment, treatment, and management training to Hoosier healthcare professionals. And it's why we're ushering in more telehealth capabilities that have been proven all the more crucial by the pandemic. I couldn't be more grateful for your strong support for prevention efforts, your care for survivors of loss, and your continued advocacy to protect life. By lending an ear, extending a hand, and by using your voice to be a voice for people who may not feel like they have one, our efforts could make all the difference for someone in need. So thank you. Thank you so much for all you're doing to give help and hope.
We are definitely grateful for Governor Holcomb's participation in our State Capitol Day event today. And next, we're going to have some opening remarks from State Senator Michael Crider. He represents Indiana Senate District 28.
Can you hear me now?
Yes, we can hear you.
Okay, sorry about that. So good evening. It's great to be with you. It's always a pleasure to meet with folks who are trying to work in the trenches to help address the serious issue of suicide. It's been my honor to have the opportunity to work in the state Senate for the last 9 sessions, really trying to advocate for policy changes and tweaks in the law that will help more effectively address this challenge that we experience. But I've realized pretty early on in my legislative career that I can put words on paper, but without the boots on the ground, the advocacy groups really putting those words into action, they really don't mean a whole lot. And so I'm grateful to any organization that is in the fight and trying to help folks get the help that they need. And I look forward to the exchange of ideas this evening. Thank you.
Thank you, Senator Kreider. We really appreciate your participation, and those words mean a lot. Thank you. Unfortunately, Representative Bard wasn't able to attend tonight, but we're going to be sure to share his remarks following the presentation. So next up, we have United States Senator Todd Young, the senior senator from Indiana. He was able to send in a video with his recorded remarks.
Hello, I'm Senator Todd Young. This pandemic has been hard on all Americans. Now more than ever, we must prioritize mental health through resources like telehealth support groups and outreach services so people can get the help that they need. According to the CDC, suicide is the 11th leading cause of death in our home state of Indiana, and the second leading cause of death for Hoosiers between the ages of 10 and 34 years. These statistics are heartbreaking. That's why I've introduced bills like the Coronavirus Mental Health and Addiction Assistance Act to provide mental health and addiction services to Hoosiers who are struggling. I also introduced the National Suicide Hotline Designation Act to designate 988 as the 3-digit number for a national suicide prevention and mental health crisis hotline. In my Mental and Behavioral Health Connectivity Act enables Hoosiers to access mental health services through telehealth during this public health crisis. I remain committed to prioritizing the mental health of Hoosiers, especially during this difficult time. Thank you, and God bless.
And although Senator Todd Young could not participate live tonight during the presentation, we're definitely grateful that he was able to send his remarks via video. Moving on, we are going to have State Representative Chris Campbell from House District 26 present her remarks. I think we're having some technical difficulties getting Representative Campbell on. So we will go back to Representative Campbell if we're able to figure that out and share her remarks with everyone. Moving on, we have State Senator Shelley Yoder, who sent in a video with her recorded remarks. She represents Indiana Senate District 40.
In August of 2013, I lost my dearest friend, Karen. Karen was brilliant, feisty, kind, funny, creative, and beautiful. She was my go-to person. You know, my WWKD. What would Karen do? When I was trying to figure out what to do in a situation, I would think to myself, what would Karen do here? Or when I was struggling with the right words to speak, I would think to myself, what would Karen say? She just had a way to heal people with her words and her presence. She herself was a healer. Karen died by suicide, and I miss her every day. There have been many times when I am driving home from a long day at the State House, and I think, oh, how I wish I could call Karen. As a mom, an educator, a friend, a human being, I think it is important to acknowledge that anyone can be struggling with thoughts of suicide. Removing the stigma surrounding suicide is an important first step. When someone is struggling with the relentless darkness and the heaviness of mental illness or thoughts of suicide, we can all do better by letting each other know the experience is real and you are not alone. We may not feel equipped with the right words to say, and that's okay. You don't need to have all the right words. Just be present and reach out to the people who can help without judgment and preconceived notions. Help is available. We can all do better to get ourselves educated and reduce the stigma. We can all do better letting people know they are not alone. And asking for help might be the bravest thing we ever do. Let's do all we can to remove the stigma around suicide and become aware of the signs and the steps to prevention.
Once again, we want to thank all of our elected officials for participating in tonight's State Capitol Day event. Just echoing some of the things that Senator Shelley Yoder said in that video, reaching out and seeking help definitely is one of the bravest things that anyone can do. And we're really grateful that she was able to share her personal connection to suicide and share her friend Karen's story. So thank you. Moving on, we are going to discuss some suicide facts and figures, and this will be presented by our AFSP Indiana board member and Project 2025 Chair, Adam Jackson.
Thanks, Drew. When speaking about suicide, it's important to use safe messaging. AFSP advocates come from many different backgrounds. Some have lost loved ones, and some loved ones through suicide, and some have struggled on their own, or support someone that struggles. And some are professionally invested in this space through their work. Telling your story can save lives, but only if you share it safely. Sharing your story lets people know that they are not alone and shows them recovery is possible. If done safely, your story can encourage people at risk to seek help. So please remember, you should be in a safe place in your recovery. Avoid discussing details and methods, as this may be triggering for those around you. Avoid glorifying suicide by using terms like successful attempt, but instead say completed suicide or death by suicide. Avoid using the word commit, as they are often related to the word is related to using of crimes. Instead, say someone died by suicide or took their own life. Share mental health resources such as the National Suicide Prevention Lifeline or the Crisis Text Line. Finally, practice. The more comfortable you are in sharing your story and talking about suicide, the more we can break the stigma associated with mental health and suicide. So when looking at the statistics for the United States in 2019, the Center for Disease Control collects and shares data with the numbers of suicides, deaths in the United States each year. It typically takes 2 years to get the data published. And the most recent data we have is from 2019. Suicide remains the 10th leading cause of death in the United States. In 2019, we lost 47,511 Americans to suicide, making it the second leading cause of death for ages 10 to 34, and the fourth leading cause of death for ages 35 to 54. Over a third of those who died by suicide were over the age of 55. It's estimated that for each suicide death, there are 25 attempts, which works out to be more than 1 million attempts per year. Now, many have asked about the effect of the pandemic on the suicide rates, and we just don't have the data at this time to share. And once we do have it, we will share it with you. What you're seeing here is the national fact sheet from 2020. So the data that actually reflected on the screen is from collected from 2018. What you're seeing is a comparison of suicide rates across the country. You can see that Indiana is the middle third of suicide rates in the US. It's important to remember that even for states in the lower third of suicide rates, there's still more to be done. Please note that this sheet, along with your will be updated to reflect the 2019 data in the coming weeks. So for the statistics in Indiana, for youth and young adults aged 10 to 34, suicide is the second leading cause of death, and suicide is the fourth leading cause of death for those ages 35 to 54. Before I hand it over to Kelsey, I just want to say one final thing on the statistics part. Statistics can be kind of sterile, and that, you know, behind each stat, there was a person who struggled, sometimes in silence, before their death. And that what's not, and as for each person we lost, there was an uncounted number of family and friends who struggled with the loss of their loved one. So that's what makes advocacy important. You become the voice of the person, of the people that we've lost, and of those that are mourning the loss of a loved one. So I'll send it over to Kelsey.
I could not have said that better myself, Adam, and it's so true. So why advocacy and why is it important? Adam said it perfectly and beautifully. We are the voice for those who have been silenced, for those who are no longer with us, and for our future too. So by advocating for issues that we each care about, like suicide prevention, that was my grandma. So by advocating for suicide prevention and mental health issues, we truly, truly can make a difference. We have amazing advocates all over our entire state, and I don't say that lightly. When we have a collective voice, it has even greater impact. And AFSP provides advocates the opportunity to share your story, to make connections with our lawmakers at the federal and at the state level. We provide a platform, the AFSP Action Center, to allow us to email legislators directly. And also advocates can advocate in the future in in-person events, and hopefully those are soon, locally here, and then also around the country, and then in Washington, DC. So our AFSP volunteer field advocates make an impact in many different policy areas, from suicide prevention and mental health. Policy priorities are determined every 2 years by our National AFSP Public Policy Council, and then also our staff at the Public Policy Office that we have in Washington, DC. Our staff work with our chapters, so we have chapters in all 50 states, and they help us determine where the gaps are and which policies will have the biggest impact for each individual state. So you can visit afsp.org/priorities to find more detailed information on top policy issues and to view and download the full list of priorities for the next 2 years. So in a follow-up email, I'll make sure you guys have the direct link to that so you can see the next 2 years of priorities. For those who may be new to advocacy, we want to address the question, where does legislation come from? And honestly, this is one of the things when I got involved with AFSP that I had to study up on and really understand the inner workings of legislation and how it all works. So it comes from legislators themselves based on their personal experiences, passions, and interests, and it comes from you, our advocates and constituents. And it comes from organizations like AFSP that work directly with legislators and other leading mental health organizations to write new policy and to provide resources to support future legislation. So how does a bill become a law? Once a legislator has an idea for a bill, they will draft the language and introduce it. Once introduced, the legislation is assigned to the relevant committee within the House of Origin. This is either the House or the Senate. For example, if we work with a senator to introduce a bill to have all teachers trained in suicide prevention, that bill's House of Origin is the Senate. and then the bill will be sent to the Senate Education Committee. The committee then has the opportunity to review, edit, and vote to the approved bill language before sending it to the floor for a full vote. If the bill is voted on favorably, it will go to the other house. So our teacher training bill, for example, if approved by the Senate Education Committee, would go into vote by the full Senate. Only if the Senate votes favorably on it would it move to the House and go through the same committee review and floor voting process. Only when the bill has been voted favorably in both houses can it go to the governor to be signed into law. Once received by the governor's office, the governor typically has a set number of days to act on the bill by signing it or by vetoing all of the parts of the bill and sending it back to the House and Senate for additional edits and recommendations. In many states, the governor can also choose not to sign or veto the bill and can instead allow a bill to become law without signature. When speaking to lawmakers or their staff, it's important to be polite and thank them for their time. You also want to be mindful of the language that you use when we discussed briefly and Adam touched on when sharing your connection to the cause. And think about this opportunity as an elevator pitch. So for example, when I do my visits, I would say, my name is Kelsey Stewart. I'm a suicide loss survivor, and I lost my dad by suicide as well as my grandpa. I look forward to sharing more information with you about the local AFSP chapter and how we can work together to prevent this leading cause of death. I'm happy to answer any questions you have. So in your communication with the legislative office, if you don't know the answer, that's okay. So I am notorious. The first year that we did State Capitol Day, that was what I was most scared about, is what if they ask me something and I don't know? And that's totally fine. We don't expect anyone to be subject matter experts or to know everything about every law. What this really does is provides you an opportunity to give them a face and a voice. And like what Adam said, elevate the stories. And so they understand who and how these laws are impacting our community. You can just say, I don't know the answer right now, but I will happily follow up and as soon as I have the answer. So what this does is it provides an excellent excuse to maintain communication with the office and further position yourself as a resource. So while you might know then, once we connect you with our public policy office, or you get connected with me or Drew or Adam to help you answer that question, then you can follow up with them and continue and build on that relationship too, which is really awesome. If you return, when we are able to do these in person, after a couple of years, or even the second year that I did it, they recognized my voice. They remembered my grandma or whatever story, we talked about. And so these really do have significant impact and really are important in sharing your story. I think a lot of times people might feel, well, this is just what happened to me and they won't remember. And that's not true at all. I really genuinely feel, especially with this topic of suicide and mental health, that our lawmakers genuinely do care and want to make sure that the bills that we're crafting and writing for our state impact us positively. So there's lots of ways to build these relationships and stay connected with our lawmakers throughout the year. We can email them and call them through the AFSP Action Center that I mentioned, and we'll walk through that again a little bit later in the evening. You can tag them on social media posts, and you can also meet with them or their staff virtually over the phone or by video. And another idea is to sign up for their newsletters so that you can see when they're hosting town halls and events in your area that you might want to attend. Many town halls and legislative meetings are now being held virtually, which offers an increased opportunity for advocates to become engaged in the legislative process. I think probably prior to COVID, we might not have thought about hopping onto one of those, but this has served a really great opportunity for us to be a little bit deeply engaged too in things like town halls and being connected with our legislators, not only in sharing our stories, but hearing their stories and why these bills are important to them as well. So it's more about building long-lasting relationships. As you begin your advocacy journey, it's so important that you know the resources that you have at your disposal. We have an amazing set of community partners across our state, and AFSP is also got amazing resources as well. So state legislative websites offer several resources to advocates, and you can identify your legislator and their contact information. You can see what laws are currently enacted and search for legislation that has been introduced in the current legislative session. Advocates can also sign up for the newsletters and find out what relevant events and advocacy opportunities are coming up in their area through these resources as well. If you are interested in learning more about specific policy areas that AFSP works on at both the federal and state level, there are several resources available to you. The Public Policy Office has hosted several policy-specific webinars, filmed sample meeting videos for new advocates that we can share with you, created issue briefs for each policy area that explains AFSP's policy positioning and shows what laws are in place in each state. You can also visit the AFSP Action Center at any time to see what legislation AFSP supports and where the bills are in the legislative process. Up here on the screen too, there are also links to statistics, so you have direct access to those resources that Adam walked through, and they're being updated too as we get updated numbers as well. So the bill tracking, the fact sheet, the issue briefs, these are all great things for advocacy, but also just great things for you to know what's going on in our surrounding communities as well.
So now we are going to go over some public policy priorities for the state of Indiana. AFSP has outlined 4 specific priorities that we just wanted to make sure that we highlighted during this presentation this evening. And everyone in a follow-up email is going to be receiving an issue brief on all of these policies that we're discussing. So the first priority is expanded access to crisis services and mental health care. Suicide is a preventable public health problem, and to prevent suicide, we really need to identify the persons at risk and take an active role in connecting them to help before they reach the point of a suicidal crisis. Connecting suicidal individuals with quality mental health care is really a vital component in preventing suicide. By offering immediate help to those that need it, crisis call centers provide invaluable support at critical times and connect individuals to life-saving services. Assessment and treatment for mental health conditions can save lives, but only if individuals at risk can afford and access their mental health care. So funding crisis lines and expanding the workforce will increase access to these services, particularly for underserved populations. AFSP supports House Bill 1468, the Crisis Line Funding Bill. The Federal National Suicide Hotline Designation Act became law in October of 2020, which designates 988 as the universal phone number for the Lifeline. 988 will fully replace the current 10-digit number by July of 2022. So full implementation of 988 will result in a large increase in call volumes, which requires more trained personnel to answer calls, mental health professionals to do the training and supervise shifts, and advanced infrastructure upgrades. The National Suicide Prevention Lifeline is a national network of state and local crisis centers that are linked through a 24/7 toll-free number, as you can see on the screen. It's 1-800-273-TALK or 8255. This connects callers throughout the US to immediate crisis care. Callers are connected with a call center in their own state, and if the local center is unable to answer, the Lifeline reroutes calls to one of 9 backup centers in their network, which may be in or out of state from the caller. Statewide crisis lines help to ensure that gaps in local services and delivery areas are served, and that we have calls that are being answered 24/7 by trained individuals to handle suicide risk and other mental health crises. And although the Lifeline has proven itself to be an essential and necessary component in mental health care system, it does consistently face 2 main interconnected barriers to its effectiveness and its success. As you can see on the screen, they are insufficient funding and the capacity to respond to increasing call volume. while the Lifeline is a national program, federal funding goes toward managing call routing, best practice standards, public messaging, and technical assistance. Local centers are reliant on funding from state and local contributors to operate and grow their centers to meet call volume. Many of them rely on private contributions and volunteers to be able to keep their call centers running. So we just wanted to emphasize that now is the time to put these systems in place to ensure local crisis call centers are adequately staffed and resourced by the time 988 is available nationwide in July of 2022, and that they have real-time access to the full continuum of crisis care services. In October of 2020, the National Suicide Hotline Designation Act became law, and this legislation does many things, and we want to outline these three specifically. It's designated 988 as the future 3-digit phone number for the Lifeline. It requires full implementation and access of 988 by that date that we've said, July of 2022. And it also empowers states to enact laws allowing for the 988 number to be funded the same way as the 911 number through monthly customer service fees. Here is a list of crisis lines that we just wanted to provide to everyone attending. If you want to go ahead and get out your phone and take a picture of these numbers, you can feel free to do so. These resources and many more are actually listed on the AFSP resource page, which is afsp.org/resources. So you can find these resources and many, many more targeted to different communities on that website. And if you aren't able to screenshot or take a photo of these, we can provide these resources and others following the presentation. The second priority that we wanted to cover is mental health workforce expansion. So AFSP supports House Bill 1021 for the workforce expansion. It establishes Health Workforce Student Loan Repayment Program. This Health Workforce Student Loan Repayment Program would provide funds to repay outstanding student loans of certain health providers. So this includes licensed clinical social workers, marriage and family therapists, mental health counselors, clinical addiction counselors, and also psychologists. And these healthcare providers agree to practice full-time in the applicable profession, and they provide essential services for a specified number of years in a health workforce shortage area in Indiana, which would be determined by the council. Mental health conditions like depression, anxiety, substance abuse problems, especially when unaddressed, they can increase the risk for suicide. So one of the best ways to prevent suicide is to connect individuals at risk with a mental health professional for assessment and treatment. And federal guidelines require one mental health provider per 30,000 residents, but very few states actually meet this requirement. So in 2020, as you can see on the screen, 57.2% of adults with a mental health condition received no treatment. And over 26 million individuals experiencing a mental health condition are going untreated. And that's something that we want to actively work on changing. There's a critical shortage of mental health care providers, which is, psychiatrists, psychologists, licensed clinical social workers, counselors, marriage and family therapists, and specialist advanced practice nurses across the whole country. This is primarily due to low wages and high turnover, resulting in little access to care, high burnout rates among providers, and also long waits for necessary treatment. And on the screen, as you can see, in 2016, more than half of counties throughout the United States had 0 psychiatrists. Public and private providers have difficulty attracting or retaining qualified employees. This impacts a community's ability to provide adequate services, particularly in rural areas. Grant and loan forgiveness programs are a possible solution to the significant mental health workforce gap. This would encourage new graduates to practice in underserved areas and provide services to underserved populations. So AFSP supports and understands the urgent need to incentivize mental health professionals to practice in provider shortage areas and ensure that services are accessible by underserved populations. So that's extremely important. So we talked about the loan forgiveness and grant programs, and AFSP also supports the use of telepsychiatry and peer support specialists and other paraprofessionals to meet the increased need for mental health services. Moving on to our third priority, it's student suicide prevention, intervention, and postvention. Coordinated mental health care and prevention efforts can save lives, and with policies and practices in place to ensure that students at risk receive the appropriate services within their school and community, preventative approaches such as staff training will be even more likely to prevent suicide. So AFSP supports Senate Bill 19, student ID cards. This requires a public school that issues ID cards to students in grades 6 to 12 to include on their card after the date of June 30th, 2022, a local, state, or national suicide prevention hotline telephone number that provides 24/7 support 7 days a week. We also support Senate Bill 374 for school suicide prevention. So this bill requires data collection, and it's on data collection for suicide and suicide attempt related to minors in the preceding 12 months. It also has the inclusion of a number for a text hotline for students to obtain immediate mental health and suicide prevention support from the community. It also requires that schools provide the text hotline number on the school's website, to include the text hotline number on any student ID cards and any printed school material disseminated to students. So email or a school employee emailing a student. Students really must be equipped with the tools to reach out should a mental health or suicidal crisis occur, and transparency and easily accessible information can really reduce the stigma surrounding mental health conditions and reinforce the notion that seeking help is a sign of strength. That's something that Senator Yoder touched on in her video, which I think is critically important. By offering immediate help to everyone that needs it, crisis lines provide invaluable support at critical times. AFSP supports efforts to include the number for the National Suicide Prevention Lifeline and other local crisis services on all student ID cards in K-12 schools and also institutions of higher education, colleges, and universities. And then moving on to our final public policy priority for the state of Indiana is conversion therapy prohibition. So if you're not familiar with conversion therapy is also known as sexual orientation change therapy. It's any practice or treatment that seeks to change the sexual orientation or gender identity of a person, including a practice or treatment that seeks to change behaviors or gender expressions, or to eliminate or reduce sexual or romantic attractions or feelings towards persons of the same gender. Sexual orientation and gender identity change efforts are based on the belief that homosexuality is a mental illness that needs to be cured. And this is a belief that has been rejected as scientifically invalid by the American Psychiatric Association and all other major mental health organizations. Major mental health organizations. Conversion therapy has not been proven to change a person's sexual orientation, gender identity, or expression. Conversion therapy can, however, invoke feelings of rejection, guilt, confusion, and shame, and they can lead to decreased self-esteem, substance abuse, social withdrawal, depression, anxiety, and importantly, increased risk for suicidal behavior. So conversion therapy is detrimental to LGBTQ youth. It has been found to interrupt healthy identity development, create mistrust of mental health professionals, and deteriorate relationships with family. lesbian, gay, and bisexual youth are approximately 3 times more likely to contemplate suicide and about 5 times more likely to attempt suicide compared to their heterosexual peers. And these rates are even higher for transgender youth. AFSP supports efforts to hold licensed mental health professionals accountable through legislative action banning the practice of conversion therapy. These laws are really, really critical in reducing the number of youth impacted by this harmful practice and supporting the LGBTQ community. That's why AFSP supports House Bill 1213, which prohibits a mental health provider from engaging in conversion therapy with a patient less than 18 years of age. And it subjects a mental health provider who violates the prohibition to disciplinary action. And now that we've covered those 4 public policy priorities, which we will be sending you an issue brief over via email, I'm going to turn it over to our Indiana Area Director, Kelsey Stewart, to go over some action items for our upcoming advocacy initiatives.
Thank you so much, Drew, for going over all of those. We appreciate it. So every advocate should have received an email from our AFSP Public Policy Office prompting you to visit our AFSP Action Center to email your legislators in support of the policies that Drew just covered for us. For those looking to take a little additional action, we can work with you to schedule phone meetings with your legislative office. Some of you, when you registered, you might have selected yes, that you wanted that. And so Drew has already followed up with you with how to reach out and connect. If maybe you were a little hesitant when you were registering and maybe not comfortable and maybe feel a little bit more confident now and would like to do that, feel free to reach out to Drew and I, and we can definitely get you set up to do that. We'll share our contact information here at the end, but we just wanted to throw that out there that it's always an option and an opportunity to connect with your legislators. We can also, we're going to go over 2 personal vignettes here shortly. And at any time you can promote suicide prevention and positive mental health in social media by tagging legislators and AFSP as well. So our Public Policy Office has set up an action on our AFSP Action Center that is directly related to today's event. Advocates are directed to the AFSP Action Center at the link that you guys see right here, which is afsp.org/action center. And you can email your legislators in as little as 2.5 minutes. And I'm not downplaying that. It truly is. I think the 2.5 minutes is an exaggeration, and that's only if you take extra time to write a lengthy about me section in the part where you can fill in, but it truly takes no time at all. And it's a great way to have significant impact in connecting with your lawmakers. The Action Center is pre-programmed with letters to elected official, which then is populated with your contact information and any personalization that you wish to add. So in that part, I can add a little bit about my family, about losing our dad, and whatever pieces I think are important to kind of share our story. And don't forget, you can also share this general leak in the AFSP Action Center on your social media outlets and encourage your friends and family and community to take action today. So currently, I think we have a little over 900 registered Hoosier Field Advocates, and our goal is to have about 1,200 by July. So if you're already registered, the challenge to you then is to see if you can get 2 or 3 people within your circle to register as field advocates as well. So for those interested in meeting with your legislators and or their staff, there are a few things to keep in mind. First, practicing that elevator pitch that we went over prior and making sure that we're comfortable with briefly sharing our story. One easy way is to practice by filling out a written vignette that I'll share in a follow-up email. I will share the templates for that for anybody that wanted to have a visit, so you have that. And making sure that you attach the issue brief that you see here. You guys all should have gotten that in an email, and we'll make sure you get that again in a follow-up email. Typically, legislative meetings are anywhere from 10 to 15 minutes, depending on the availability that they have. So we might not have the time to talk about every single priority. And that's why we encourage advocates to select one passion point on the issue brief that you're you're most drawn to and talk about that during your meeting. The legislators will receive an electronic copy of this issue brief from you and then also from AFSP. So if you're not able to talk through everything, that's totally fine. Finally, don't worry, again, if you receive questions that you don't know the answer to. None of us know everything. And I think the best advice that I got when I was just learning to be an advocate is they're legislators and they're senators, but they're people first. And so really what you're doing is having a human to human conversation and just kind of stripping it down to that so that you aren't overly intimidated and knowing that you're just talking to someone, sharing your story and talking about why some of these bills are important to you. If you don't know the answer to things, again, it's totally okay. And it gives you the opportunity to stay in communication with the office and build those relationships. Our public policy office is more than happy to work with all of our advocates to help answer questions that either the legislator has or even you might have following the conversation. So here you'll see an example of some of those vignettes that I mentioned. This is from last year's State Capitol Day when we were at the State Capitol in downtown Indianapolis. So a lot of times we'll have them printed off and on display, and then they're printed and included in the legislative folders for the in-person meetings. So after the meeting with the legislator's office, it's important to follow up and offer yourself as a resource for the future. You should send a personalized thank you note or an email with a copy of your vignette if you hadn't shared it during the meeting. This vignette provides the legislators and their staff with a name, a face, a story, and ultimately a person to vote in support of suicide prevention and mental health. So you can include a picture of your loved one lost or the person who you advocate for who's struggling, or even a picture of yourself as well. The picture is not required either if you don't want to do that. So on the bottom too, you can see that there isn't a photo. So for those who indicated in the registration that you were interested in scheduling a phone meeting with your legislator, there's a few final reminders. You will receive an email from us with the name and contact of your legislator. So Drew sent those out last week. And if you didn't get it, then I would just check your inbox or your junk or spam for that advocacy.afspin@gmail.com. If for some reason you didn't get it, feel free to reach out to us and we'll make sure to resend that to you. You'll get a sample meeting request email that you can use in your meetings to schedule. So you don't have to figure out what you're supposed to say or anything like that. We've got a template that you can at least use as a starting point and then reshape and reframe it however you like. You'll also get a link to the legislator meeting feedback form so that you can share any information about what you discussed on your call and if any follow-up is needed. And then we'll also provide a sample thank you note just so you have a template as well for how to send a thank you after. And again, if you didn't receive any of the information and you you've changed your mind and you'd like to have a legislative meeting, that's not a problem at all. Feel free to reach out to Drew or myself and at either of those emails, and we're more than happy to help get you connected. So you can become a field advocate. Just go to afsp.org/advocacy. It truly is a really, I don't want to oversimplify it, but it truly is a really amazing way to have significant impact. What better way to have our voices heard than right on the Senate and House floor and letting them know a little bit about who they're representing, maybe some stories about who we've lost or who we're fighting for as well. So it's not very time consuming to sign up. It should probably take anywhere from 2 to 3 minutes to sign up, and then you'll get emails directly from our public policy office, and they're wonderful to work with and super helpful here at the local level for Indiana and then at the Hoosier at the federal level as well. This is just one of many of the events that we have within our Indiana chapter. They're all looking a little different, so we're keeping our website updated. So you can look for trainings, things like this, upcoming Out of the Darkness events, and any other thing that we're engaged with at afsp.org/Indiana. There's also contact information for the chapter and other ways to engage as well.
So that is going to conclude the main portion of our presentation for this evening. We just wanted to thank you again for attending. Your participation and your support of AFSP's advocacy initiatives are crucially important in ensuring that we are able to support and pass mental health and suicide prevention legislation, not only at the national level, but at the state level here in Indiana. We want to encourage you to follow AFSP National and also AFSP Indiana on Facebook, Twitter, Instagram, and YouTube. At this time, we are going to go ahead and have a short Q&A session. And if you have a question, you can drop it in the chat and we'll get to as many as we can.
We also have Chelsea from our public policy office in Washington, D.C. joining us as well. So she's here on as a resource for us too. So feel free, like Drew said, pop questions in the chat and we will do our best to either answer them. If it's a question that maybe you don't feel comfortable answering or don't want a response in the larger group, you're also welcome to those emails that you saw on the slide or got the email with the Zoom link. You're welcome to email that as well. Does anybody have any questions that we can help address? So we got a comment in from somebody and it says, I think my biggest question was the wording and who to contact, but I think I got all of that answered. So we'll be sure to make sure that we follow up with you guys. And any of those things that you got last week, you guys will look at again. And just some templates. It's mostly used as a guide, but obviously you're able to add your own flavor and language and make it personal. Like I said, you're speaking human to human, and that's really what they want to. It's a conversation. Ideally, we would be meeting in person and we would be able to have some heart-to-heart, eye-to-eye conversations. And so I know some of these phone call conversations, when we're being so vulnerable and sharing about our loved ones, we might not be able to feel as comfortable, but they really do care. And I think it's important if you are able to try and connect with your legislators if you feel comfortable.
Yeah, and as Kelsey said, we're going to be following up and providing you some materials via email. One of those materials that we're going to be sending out is a flyer that is, it's called Speaking Out About Suicide, and it gives you some tips on language that you can use and language that you might want to avoid when speaking out about suicide, or some language to ensure that you're using safe messaging guidelines whenever you're talking about suicide or discussing suicide with your legislators. So that'll be provided to all of you, and that's a resource that you could use. All right. Kelsey, are there any other additional questions in the chat?
I think Chelsea had a few remarks that she wanted to address as well.
Yeah, well, we have everyone. I just wanted to thank you all on behalf of the Public Policy Office in DC and also AFSP National out of New York for taking the time today to get educated on these issues and taking the time throughout the week to email and have phone calls with your state legislators. It really does make a difference. The most important piece is sharing your story and making that personal connection. And more often than not, you're going to find that the staff member or the legislator that you're speaking with has a connection themselves to this issue. It really does make a difference. And from the bottom of my heart, thank you all for being here today.
Chelsea, we do have a question around Senate Bill 32 and House Bill 1213, and asking if the action go for only licensed mental health or all counselors, like in church settings.
Typically, this legislation does not apply to those other settings like in a church because there is no licensing board that sits over them. So I would have to look at the legislation specifically, but 98% that this is just mental health counselors, anyone that requires a license within the state.
Thank you. I'm trying to look through all of the other questions, sorry. One question came through is, will we receive a video of this via email? And yes, it's being recorded. And so once it renders on my computer and then I can get the link, it'll be in the follow-up email that you guys receive. And we'll also try and post it to our social media as well. I think we have one other representative that was going to hop on and she just ended session. So let me double check on that 1 second, guys.
And while we're waiting, I would say if you haven't done so yet, now's the time to go to the AFSP Action Center and send your round of emails to your state legislators. As Kelsey mentioned, it takes 2.5 minutes to send those emails, and there is an opportunity for you to add some personalization in there. So it's a really quick ask. It's something that you can also share on your personal social media pages and get other folks involved as well.
We have Representative Chris Campbell with us. Awesome. The floor is yours.
Hi, thank you so much for having me. I'm so happy to be here to discuss this really important issue. And I'm sure you've already discussed this, but suicide is the leading cause of death in the 11th leading cause of death in Indiana, 10th leading in the nationwide, second leading cause for deaths among 10 to 34-year-olds. On the average, there are more than twice as many deaths by suicide than homicides each year. One person dies by suicide every 8 hours in Indiana. Over the course of the pandemic, mental health issues have been so exacerbated nationwide. The CDC has found reports of depression disorders have quadrupled, and thoughts of suicidal thoughts have doubled. Disproportionately affects members of the LGBTQ plus community, with 42.8% of LGBT youth reported to have seriously considered suicide, 4.5 times more than average. And transgender adults reported a lifetime rate of 40% attempted suicides. This year in legislation, we've had Senate Bill 19 would require schools to print the number 24/7 suicide prevention hotline on every school ID. That passed out of the Senate and should be heading our way to the House next week. House Bill 1185 would require schools to adopt discipline rules on prohibiting bullying. Unfortunately, that bill did not receive a hearing this year. In the midst of the past year, we have watched a crisis of mental health unfold outside the public eye. Sadly, it isn't surprising. Depressive disorders may not stick in the headlines like the viral pandemic. Deaths by suicide are not covered in the news like other events, but these are really real, devastating challenges facing our Hoosiers, and we cannot let this go overlooked or ignored. No one should have to suffer in silence. We need better ways to find ways to connect, to help those who need it. Too often, people are afraid of seeking help and don't know what help is available. I hope the House can come together to get that hotline contact on every student ID in the state of Indiana. We need to assure them that no matter what, no matter when, no matter where, someone is there for them. Bullying, of course, has been a problem for far too long. And now in the digital age, it's brought new threats in how bullying can occur, reaching every corner of a child's life. And new challenges need new approaches. And we need to face this issue head on. It's time to take mental health care seriously in Indiana, in our laws and in our budget. Right now, the budget has made drastic cuts to mental health in Indiana. In Indiana, we have failed to create safe spaces for LGBTQ Hoosiers. And any conversations addressing mental health in our state has to come to terms with how to shatter the walls of bigotry, to fulfill the promise of welcoming all. While I'm hopeful for the promising legislation that we have to remember that at the end of the day, what really comes down to it is personal interactions and relationships. How can we better listen to each other and take care of each other? We all have to be better neighbors. We have to be honest with ourselves about the ways and our words and actions are taken and how they affect those around us. And even more so, our legislators. Millions are watching every day on their TVs and phones, what we do, the things that we say, the post, and to tell people what kind of place Indiana is and what kind of place we want to be. I ask that you help us by advocating for mental health in Indiana. Right now, the budget is passing out of the House. We asked for increases to mental health, but those additional funds were not added. So right now that the budget will be going to your senators. So please reach out to your senators and ask them to increase funding for mental health. Those critical dollars are so important in our state. Thank you so much for having me. Thank you.
Thank you, Representative Campbell. We really appreciate those words, and we're really glad that you were able to join in tonight, specifically voicing your support for Senate Bill 19 for the student ID cards, and then also highlighting the impact that suicide has on LGBTQ youth and our LGBTQ Hoosiers. So we really appreciate it. Thank you so much.
Thank you.
And that is going to conclude our presentation for this evening. As Kelsey said, we will be following up with everyone with an email with materials and resources to take action to fight suicide in our state and to get involved and become a field advocate. If you are planning to set up a meeting with your state senators and state house representatives, we encourage you to do so by February 26th, I believe is the correct date, by the end of next Friday. And we're going to be providing materials on how to do that. Please feel free to email advocacy.afspin@gmail.com if you have any additional questions related to having a meeting with your state senator or state house representative. So again, thank you all so much for attending this evening. We really, really appreciate your continued support to fight suicide in the state of Indiana. Thank you.
Thank you, everybody. Have a great evening.